welcome to all our OrthoTV viewers. Today, we are back with the Caregivers Perspective, Personal Stories, and My Journey by Dr. Dhruv Dave for part 2. Hope you enjoy the second part also.
Another sort of concern that happens with the issues is about the disability is to be considered as a sort of taboo. Now, here I need to mention it about a sort of story in context to that of the cancer survivor. Initially, when someone who is going to be diagnosed with cancer, it's going to be a very difficult state of mind for the patient as well as for the rest of the family members to consider it as part of acceptance. And then once they are ready to accept the sort of concern, then the rest of the problem starts. And this is specifically in context to that of the breast cancer, oral cancer, lung cancer, and likewise, where rest of the other problem starts happening. Then people are not taking the things in the usual manner, and that is how the things are to be taken into consideration. Sorry. Breast cancer, the third of all the cancers in the country, is what is the women are suffering from, and it's a costly taboo because the kind of care it is what is required in context to that of the cancer is a sort of a major concern, and the rapid transition of the urban lifestyle even into the rural area, and in context to that of the oncologists, they want to be more aggressive in terms of dealing the cancer at an early stage, so that at relatively younger age, the things are to be addressed, and the kind of chance of survival rate would be as much as possible. But if we look at the prevalence of taboo and the lack of awareness, that ultimately is resulting in the late presentation. And this has happened not only with cancer, but with most of the chronic diseases, even in similar contexts in communities where we are addressing. And so far, for about 25 villages, we have done a sort of door-to-door survey. Most of them, they are not ready to accept their lifestyle diseases, may it be hypertension, diabetes, obesity, and likewise, that they are not ready to have the sort of concerns in relation to their lifestyle diseases. They are not even ready to accept that they need to have a sort of routine checkup, and if the issues are accordingly, the things have been addressed and made. And that's the reason why the late presentation, including that of the cancer, happens, and then it would be very difficult for the healthcare professionals to combat any of the things, and where our role as a physiotherapist in terms of primary prevention, primordial prevention, a major sort of concern. In terms of the socio-cultural belief, which I was talking about after the sort of denial mode, people considering their disability as part of the karma or immoral behavior, or they may give the blame to the modern sort of lifestyle, a sort of hush attitude, as what it has been said in the Japan. In Mexico, the socio-cultural belief is to they consider it as part of the punishment, which ultimately has eventually entered into a sort of disability, and the victim blaming starts. Now, when I'm talking about the caregiver's perspective, I have done a sort of search, and then we also need to know that how the burden in context to that of the caregiver, and what sort of outcome measures which are what available, which could be utilized, and as what the previous professor has said, we also need and take into consideration that do not take these outcome measures as per the straightway the face value, but we also need to take into consideration to have the development of a few of the outcome measures where the Indian context is very much necessary. So if I'm talking about the caregiver burden, the outcome measures which are what available are like Beckett's caregiving outcome scale, or modified caregiver appraisal scale, or Zarit burden scale, which otherwise is giving us a sort of concern in context to that of what sort of burden that is happening to the caregiver when they are handling the various problems that their particular individual is suffering from. Another sort of concern is in relation to when the disability happens, how the family is looking at the particular picture of the disability. And in similar context, for family function, dyadic adjustment scale of 32 item, which is a sort of self-report case of the relationship satisfaction. The experience in the close relationship revised scale also will give a sort of 36 item, which gives ultimately the extent of the people who are uncomfortable being close to others, and likewise, and the family assessment device, which again is one of the very useful in context to organizational and transactional characteristics of families, how family behave, and ultimately addressing the particular disability that happens to them. In context to the functional status of various individuals, the community integration measure, one of the very good scale which is being advised to the community reintegration scale, where the questionnaire to identify prevent the community reintegration problems, and how that is to be ultimately addressed. FIM in context of the functional independence measure, which we routinely use in chronic illnesses with that of the paralysis and a few of the other cases, where it gives that how much amount of support which we are giving in context to that of the individual for their independence. And as in video also it has been shown and suggested that how much is what is the sort of independence you are in a position to provide. And from caregivers perspective, it is always very much necessary that one should be in a position to provide as much independence as possible. Here I specifically need to mention the sort of Indian context. What happens in most of the cases in the acute phase during hospitalization, or even after the discharge, for initial 2-3 weeks, in Indian context, the family members, the one who are very close to, and likewise the near ones and dear ones, are providing complete care to the individual, and that ultimately hampers the individual's independence. I mean by that, all the activities, even if the patient is in a position and able to do, are being provided by the caregivers, and that ultimately change the status of the individual and increase their dependency over the family. And as we all know, that as the chronicity of the disease goes on, ultimately it would be difficult for most of the caregivers to sustain the similar sort of support which initially after discharge they are in a position to provide. And that's the reason why it is very much necessary to respect the independence of the individual and provide as much independence and as least support as possible, and even in the film suggesting similar context. And the other one is about the patient competency and the rating scale, another scale for the awareness and degree of difficulty while performing the various tasks following the traumatic brain injury. In terms of the psychological symptoms, if we are talking about, we are very routinely viewing about the back depression inventory and the hospital anxiety and depression scale for most of our clients, and by that we are in a position to understand and address that where exactly the sort of problem exists and how in a healthcare perspective we should be in a position to provide them the sort of care. Now, when we are talking about the caregivers, it's also very much necessary that we also need to understand about the caregivers and its types. When we are looking at the caregivers and the sort of types, there are mainly two types of caregivers, the traditional and the non-traditional one. The traditional caregivers are the caregivers which ultimately are having a sort of formal training to provide the care to the patient population, and likewise, while the non-traditional one are the sort of relatives which otherwise are not knowing, but through their experience are in a position to provide the sort of care. Now, most of the time what happens, again in Indian context, about the sort of financial issues that happens with the chronicity of the disease, that the traditional caregivers to provide the care would be a sort of greater challenge. Again, most of the time, the chronicity of the disease also induces the sort of financial constraint to the family, and that's the reason why affordability of traditional caregivers is going to be jeopardized and affected. In terms of non-traditional caregivers, as what it has been mentioned, the sort of mental health issues eventually over a period of time, including depression, anxiety, stress, and many of the musculoskeletal issues also happen, as what it has been mentioned in the example of kids with the disabilities, that as the baby grows, simultaneously the parents also grows, and the age related issues are bound to happen to them. And in terms of denial mode of those are causing a lot of problems to the caregivers. In terms of coming to the quality of life, life satisfaction survey and the perceived quality of life and satisfaction with the life scale along with the life satisfaction survey are the various outcome measures which are otherwise able to be utilized in terms of testing and identifying the quality of life of the caregivers after having the disability for certain number of years. Another sort of concern that happens with the caregivers is what I have mentioned about the financial constraint and issues, and that is where one need to take into consideration about that their knowledge and education need to be improvised upon. And as the knowledge and education of the caregiver is improvised upon, the support system in context to that of the finance from the government side would need to be addressed, and accordingly, if they are in a position to get sort of certificates that will help them in some or the other way, maybe in transportation, maybe in context to that of there are various schemes also available for the disabled, and which ultimately help them to get some sort of benefits at the government level. According to the act, it's very much necessary, that is in general, that one cannot insult the individual and humiliate the person with disability at any place in context to the public view, as it is a punishable offense with imprisonment. And the special courts in each district are handling the cases pertaining to the violation of the Rights of Person with Disability Act. These all things are the sort of legal aspects and the information which need to be provided to the caregivers so that they are better able to address the problems they are facing. Most of the time, what happens is that the sort of issues that happens to the patient as well as caregivers, but they are considering it as a part of silent individual in terms of taking the disability as part of the curse and not going further with that context. Another sort of concern, which is what is about the Accessible India campaign, and the previous speaker also has elaborated this in very much detail in context to that we need to see to it about the various public places need to be accessible, and that's how the caregivers as well as the individual, the Divyangjan, be part of the society and community. We need to see to it so that they are better able to be part of and be inclusive in context to that of the growth of the city and country. I'll just share another video.
Thank you so much, sir. It was really inspiring and enlightening. It's truly a journey of empathy, resilience, and transformative powers of the caregiving experiences. Once again, thank you so much, sir, for coming and sharing your valuable experiences.
Thank you. So nice of you, Dr. Fareen, for providing the platform. And this is a sort of platform which is considered to be very much necessary in context to that of where the individuals who are coming a day prior on World International Day of Persons with Disability, and are ultimately highlighting the issues which otherwise the people are facing and how to address those issues and problems. Thank you very much.
Thank you, sir.